right. Okay, so thank you very much once again. My name is Dr. Albert Sedu here. I am your humble host for the Weekend Health Talk. And today we're going to discuss the very important topic, peptic ulcer disease. A lot of people talk about ulcer. I have ulcer. Doctor says I have ulcer. This and that and that. And a lot of people use it to misinform a lot of people. So this evening, we have an expert on the topic, on the subject matter, who is going to share with us all that we need to know about peptic ulcer disease. Now, this young man, before I even introduce him, I just want to again remind us all why I choose to be doing this. I just want to remind us again why I choose to be doing this. All right, so he's an expert on the topic. It's always good to hear from people who know what they know. All right, okay, it's always good. If you're ready to hear from our expert for today, please put ready in the chat box so I know you are ready. Just for some few minutes, if you're ready, put ready in the chat box. If you're ready, put ready in the chat box quickly. If you're ready, put ready in the chat box. If you're ready, put ready in the chat box. Let me be sure you are ready, because he is on standby. He's ready. He's ready to share his life. He's ready to share with us all that we need to know. So just before I bring him on board, I just want to remind us briefly why I choose to be doing this weekly. All right, this is the reason why. Because when it comes to health information, there's a lack of adequate health education in our schools these days. It used to be in the past that there was a lot of health education, but these days there is very limited health education in our schools, accurate health education for that matter. And there is so much lies and misinformation, of course, from the media and unqualified personnel as well. So I decided to correct it in my little way by bringing on board experts in each of the fields, with each of the topics, so that we get accurate information for our own consent decision making. All right, so prevention is better and cheaper than treatment or cure. That is very true. So if you get accurate information from the medical expert or from the expert in a specific field, you know how best to treat, to manage, to cure, or to handle whatever condition you have. And accurate information is key in your informed decision making. And of course, these days, all of us know that there is very short contact time when you go to hospitals these days. Very short contact time. So a lot of you have questions that you will not be able to ask your regular doctors on a regular day. I choose to bridge the gap in my little way by hosting this program every weekend, all right, to help us. And the quest for shortcut by most people have health conditions, and they just want quick solution to it. When that condition may be a chronic one, you need to know how to manage such a condition. All right, so thank you very much. At this juncture, I want to introduce our guest speaker. He is a brother to me. This guy, I met him in Kolebu Medical School. We all trained in Kolebu, and we are both still working in Kolebu. Of course, he is a very senior doctor in Kolebu Teaching Hospital. He works in the Kolebu Teaching Hospital Surgical Department. He is an expert on the field. He's married with kids. All right, he's married with kids. Please, it's an honor to have such a very busy person. In Ghana, surgeons are very, very busy. They have very little time on their hands because they spend most of their time in the theater. It's such an honor to have on board my brother, colleague, Dr. Michael Kwapon-Nyakum, to share with us on the topic peptic ulcer disease. Dr. Mike, please, over to you.
All right, thank you very much, Dr. Sedu here. I'm very pleased and honored to share the stage with you this afternoon. And I must say, I'm very happy with the reasons why you stated you've been doing this thing. I mean, there's a lot of misinformation out there. I agree with you. And a lot of people need to appreciate that. I mean, there's really no shortcuts. In the end, it becomes something that you pay for out of your nose. You sweat for whatever information that you are getting, be it good or bad, especially if it's bad. So it's important everybody gets to know what's important, what is true, what is correct, what's accurate, and then be guided by that. So, I mean, I'm also very excited that we have a lot of people on the call. So if you are ready, you can just put in a comment box, ready once again, and then we just continue. Dr. Albert, can I share my screen? Right.
Go ahead.
All right. I hope everybody can see, can hear me. If you can see, if you can hear, just type a Y. If you can see, if you can hear, type a Y. If you can see, you can hear, type a Y. If you can see, you can hear, type. Awesome, 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 awesome. So today it's going to be beautiful. It's going to be crisp. Really, we are going to talk about peptic ulcer disease. I quite remember when we were in secondary school, during time for dining, people would say, as for me, I am pepper free, I'm pepper free. And usually these people got quite some different kinds of food. Sometimes they had lots of good things in their stews, and a lot of people, even without having any reason to be pepper free, chose to become pepper free. All right. And it's something that is very common, the topic peptic ulcer disease. It's rather common, and it used to be associated with a lot of complications, but now because of the treatment available, you don't see all those complications. And also because of the treatment available, a lot of people abuse the treatment because or they think any kind of stomach pain is probably ulcer because I haven't eaten. It might as well be just hunger pangs that you are feeling, that when you eat it will go away. So it's important to really know what it is, and then what you can do about it, and how you can help yourself and others improve your lifestyles with it. Because I know people do well because, one, they have skills and they have the talent and whatever, the knowledge and the know-how to do well. People also do well because they feel well. If you are healthy and if you're able to go about your daily activities, you can crush your goals. You can do the things that you want to do. People also don't do well because, I mean, for a simple fact that they are not feeling well. If you're not feeling well, you're always having pain somewhere. You're always having this condition here and there. Your productivity will drop. Everything about you will drop, and you probably may even go into depression because, I mean, all you are thinking about is how to get out of this illness one way or the other. And so today, this is how we are going to talk about the disease. We're going to look at what it is, what it feels like to have it, and then how to treat it, and then what else you can do if you have an ulcer. And then if you have any questions, you can ask. We'll take a few of them, and then we'll crown the day. All right. So what really is peptic ulcer? Now, peptic ulcer is an open sore in the stomach. Now, you can see on the diagram on the right, I'll just point to that shortly. Now, this is where you eat the tube, then it passes to your esophagus, and then into your stomach, which lies here, and then into your intestines, and then it flows and goes on and on and on, and then it comes out of the other doorway. Now, most of the time, the peptic ulcer disease affects, this is your stomach, and then this part of the duodenum, usually the very first part of the small intestine, this part of the duodenum. Other times, it can climb up here, but I mean, you may not call that peptic ulcer. It also has something, a different name, but then the feeling is about the same. So this is what peptic ulcer is. A sore, an open sore in the stomach or in the duodenum, or the first part of the small intestine, and it is usually because of increased acid production or apparent loss of protection from acid. And then, the stomach also produces enzymes or other things that help your body digest food. So when the acid and then that thing comes together, they sort of digest the tissues, and then you have that open sore. So that's what really peptic ulcer is, and it can happen here or it can happen here. Most of the time between here and then here. And quite a number of times it's associated with a lot of acid production. And people want to know, really, what causes it? Are there any risk factors? So risk factors are things that would increase your chances of getting it. And then causes are really the things that you can point to, that this is the reason why this is happening. And chief of that is an infection with a certain bug called H. pylori or Helicobacter pylori. Now, it's been said that almost 50% of the world population, some other texts also quote that even more, have this infection. And not all the strains of this infection cause cause this peptic ulcer disease. And especially in underdeveloped countries, people get this infection before the age of 10. Mostly in the developed world, they get it probably later in their adulthood, or because of lifestyle activities or socioeconomic status. This infection it's rather common, much more common than we think it is, and it has lots of routes of spreading. Probably because it is something we call something fecal oral. So either you contract the infection from somebody's feces contaminated food or feces contaminated water, or from somebody's saliva. These are just some areas that you can contract this infection from. So the reason why it is very rampant in underdeveloped countries is because they usually don't have potable or clean sources of water for their daily activities. So by and large, their water bodies are just contaminated, and then they take it and they have it. And it can cause a lot of things. This H. pylori, various strains can cause different kinds of illnesses. Some can be very, very serious, and very rarely you can have them being the reason for even stomach cancer. So it's not something to be toyed with at all. Other people too may not have, or probably would have cleared the infection because of treatment giving, but then they have other things that they are taking, like medicines, especially what we call the NSAIDs, or the non-steroidal anti-inflammatory drugs. So the aspirins, the diclofenac. So any combination drugs. We have quite a number of these combination drugs. Paracetamol, aspirin, caffeine, the PAC, APCs, aceclofenac, diclofenac, brufen. All these are NSAIDs. And people just pop them just because they have pain somewhere. Other people are not able to, for some reason, because of probably a condition they have, maybe for very bad joints and very bad body pains. Maybe our older folk, they are usually always on these medicines, the aspirins or these NSAIDs. Now, chronic intake of these medicines can also lead to having these ulcers. Aside from that, there's also genetics. It can be the fact that there's something about your genes, maybe in your family, something about it predisposes you to having increased acid output in your stomach. So then your body produces a lot of acid, and then you have a lot of other associated illnesses. So it may probably be because of genes. And one very important risk factor, not just for peptic ulcer disease, for cancers, and almost any bad thing or any bad disease that you can think about in the body, is smoking. And I don't know, thankfully in our region, I don't see many people smoke. Very hardly do you get to hear people admit that they smoke. Well, and it's a good thing, because smoking is really not very good. You just get the toxins in your blood, and it spreads everywhere else in your body, causes a lot of other illnesses. Alcohol is something that's here and there, whether to limit alcohol, to stop it altogether, or to drink alcohol because it kills bugs, because that's what you use to wash your hands. That's what you use to clean your hands or sanitize your hands. Well, it also has its own effects, all right? It's apart from increasing your risk for these peptic ulcers too, it also has effects on other specific organs like the pancreas and even the liver. It's important that you have a correct idea and then a correct perspective about what to take. Of course, certain foods and beverages too. Like I was saying, people would say, well, when I take pepper, I get ulcer. When I take this food, I get ulcer. Well, fine. You may have symptoms that are that look like ulcers. They probably may not be ulcers, but then again, you know the foods that give you these symptoms, these discomfort in your upper abdomen. And generally, we call those symptoms dyspeptic symptoms. And ulcer is not the only thing, or peptic ulcer is not the only thing that gives you these dyspeptic symptoms. So we have something called non-ulcer dyspepsia. So it can be because of stones you are forming in the gallbladder, it's because of maybe reflux, what you call heartburn, or it can be anything else. In other circumstances, you probably may not even put your finger on the exact cause of the dyspepsia. So then it means you'd have to identify these foods and beverages that give you these symptoms. And yeah, stress is something that is very important, especially in our very busy days that you have to run so fast just to stand still. The economy is racing, and it seems, I mean, the faster you run, the more it looks like you want to stand still. You have to run so fast to be able to stand still, and it brings a lot of stress to families, parents, children. Everybody is stressed, not just because of the economy, but I think because of the workload of things and the things people do. The stress of losing somebody, the stress of even having an accident or even burnt. All these things have effects on the stomach and on the protective lining of the stomach. So it's important to have all these things in mind and then know which one of them that applies in your case. Now, if somebody has peptic ulcer, how the person feel like? We all know the abdomen. Most of us, or we are accustomed to knowing the abdomen as this part of the body, the lower part of the torso, the part getting to the bone where the groin is. But as a matter of fact, that is your lower abdomen. There, your abdomen, you can touch your own abdomen. That space between your rib cage in the middle over there, all down the ribs, by the sides, all down to where the bone is in the middle, down here, and then all up to the sides again, and then all the way up to that place again. So all that area is your abdomen. But then we tend to call the upper part my stomach, and then the lower part my abdomen. But as a matter of fact, the whole place is your abdomen. And so you can have your upper abdomen, your middle abdomen, and then your lower abdomen. Your middle abdomen really is where the belly button is, or your navel is. Now, people who have peptic ulcer disease, or people who have ulcer for short, they usually have pains in their upper abdomen, that region just below the rib cage, or in the middle over there, where that inverted V is. Usually that's where they have it. And that pain comes on. So for the ulcers, it can be in the stomach, or it can be in the duodenum. And usually for the ulcers in the duodenum, or that small part of the that first part of the small intestine, the pain usually comes on at night, at the time when food has left your stomach, and so the acid can just move over the wound and cause pain, usually at night or at dawn, and it wakes the patient up, and they usually would want to find something to relieve the pain, and they usually go on for milk, or in our local settings, we have some of these medicines at home, J or Aludrox, or milk of magnesia, anything with milk or anything with antacid effect, they take it and then they are relieved. Eating usually helps the pain. So it's important that you appreciate this. And the pain is usually in the upper abdomen, and then it comes on at times that there's usually no food in the body. And aside from that, it's associated with nausea and vomiting. Now, there's also the ulcer that happens in the stomach. And that one, usually it's made even worse when food passes over it. So these ones have more vomiting, they have more nausea, especially after they have finished eating. And because of the nausea and vomiting and pain with eating, they tend not to want to eat a lot, because anytime they eat, they have pain. And these things can get complicated because of the open wound. The ulcer can bleed, and it doesn't have to always be torrential. So for somebody who is not taking any blood forming medicines or blood forming supplements, like any iron containing supplement, when you see that your stool is becoming dark colored stool, you haven't drunk Sobolo, or you're not taking any iron supplements, but then you every once in a while get dark colored stool, it's something you should think about. It probably maybe because you have something up your gastrointestinal tract that has to be looked at. Others can just vomit frank blood, and if the bleeding is very torrential, I mean, you can have frank red bleeding from the backside. All right, and these things can go on and become even chronic, these ulcers. And once they become very chronic, sometimes when they happen or during these bouts of exacerbations, they can become so severe that it blocks the outflow from your stomach. And so you tend to have obstruction. So then these people always be vomiting. They can't keep any food. And they'll be having distended abdomen because then anytime they eat and then because it's not able to go down, the stomach tends to open up. It keeps opening up. And then at a point, they throw out after 3 or 4 days of stale food, rotting food, or I mean, all these kind of things. For other people, it can perforate, and that becomes a dire emergency because with perforation, almost always all the time, you'd have to go under the knife to have that repaired. And I already talked about it, the bleeding. So it's important that looking at all these things, you need to see what to do if you are having any of these symptoms. Like I said, it is not just ulcer that causes all these symptoms. You can have other things that cause, but it's very likely that if you're having any of these symptoms, ulcer it's playing a very big role, or ulcer could be a very big culprit to your feeling of these symptoms, whether it's the abdominal pain, whether it's the nausea and vomiting, anytime you are feeding or anytime you are hungry, anytime the pain comes. And then when you have the pain and then you take these antacids or drink milk, it improves. And then when you start seeing this dark stool, so for other people too, they probably may not have noticed the color of their stool, or they probably just oblivious about it. You start feeling weak, as you don't have the energy to be going about doing a lot of other things. It's probably because you have lost blood, you're anemic. And anemia in somebody who doesn't have any specific condition is something that really has to be looked at. It probably may not just be ulcer, it may be something even more sinister lurking around in your gut. So it's important to have all these things checked. And you want to know, how would I know for sure I have peptic ulcer? And there are a number of tests, and usually the gold standard is what you see. And this tube on the picture on the right is called an endoscope. It's one of the very uncomfortable things people have to endure. This test, a tube is passed through your mouth. Of course, you'll be prepared for it, and various things done so that it becomes as bearable for you as possible, just so that we can see the lining of the stomach and then go into the small intestine as far as we can to see whatever is there. So what you see really, most of the time, helps you know what you are getting. Sometimes what you see may not be what you get. So that's what's called endoscopy, an upper GI endoscopy. We can have some that goes the backside, that's a lower GI. But for the purposes of the ulcer, an upper GI suffices. And once you go there, you can see the stomach and then see if there are any changes in the stomach, any kind of inflammation, any redness, or any open wound, or any bleeding, anything. If there's any lesion, any mass, anything, you can see it, and you can take a sample. A tissue sample is they just take a small bit of whatever suspicious area there is, and then we take it to the pathologist, and he takes a look at it. Then again, we're able to culture the organism, the bug, the H. pylori. It also has its own reactions that you can test for even at the endoscopy suite. So then you know you can be sure just before you leave the endoscopy suite that you probably have H. pylori or you don't. And the bug is also able to metabolize certain things. And so a breath test, you are giving something to drink, and then you're giving something to drink, and your breath is analyzed. It's also something that can be done to see if you have the bug that usually is responsible for the ulcer. And blood tests for the bug usually relies on your body's ability to fight off this infection. Tests, or we call research, has shown that really those blood tests may not be entirely accurate, because even after you have cleared it, the antibodies may still be lurking around in your body for a while. It may give you a false indication that the bug is still around, even though the bug is not there. So we can even test for the bug in your stool. So most of the time, it is either the stool test or the endoscopy and tissue sampling. So it's important that you get to know that this is because of H. pylori, or it is not because of H. pylori. And of course, before you are subjected to any of these tests, you'll be spoken to, and then the risk factors elucidated. Once we know that, oh, probably this man, it's probably because he's taking a lot of painkillers for certain joint issues, then probably that's the reason. It doesn't also mean that if you are taking painkillers, it isn't because of the bug. They can all coexist, really. So it's important to talk to a professional, and the most likely reason for your symptoms are elucidated. So yes, the endoscopy is really something that is done a lot, especially if the suspicion is high for the ulcer. Now, because it's something that is modifiable, you can treat it. It's important to seek expert opinion. A lot of people would want to talk to friends and then say that, oh, I've had this. Oh, I also had the same thing. You know, when I had it, the person I saw told me was ulcer. Yours is probably ulcer, because is it happening at that same? Oh yes, then it is ulcer. I mean, that kind of thing, really. The Me Too syndrome. The fact that somebody had a certain pain somewhere doesn't mean if you are experiencing a similar kind of pain at a similar region, it is definitely the same thing. This is one of the places that it's not always the same. All right, like I said, it can be any other kind of thing. It can be non-ulcer, and depending on your age and your various risks, it can even be something totally different. So it's important to seek expert opinion. And once you have seen the person who is capable of treating this thing, the main aim of treatment is, one, to reduce the acid output, because by and large, the acid is one of the major reasons why the ulcer is there. So there are medicines to reduce acid output, and then there are medicines to also sort of coat the stomach and then the duodenal lining, so that the acid may not have the direct effect on the stomach wall. Once you coat these things, then the bug is not able to, or the effect of the acid or the digestive juices are not able to have their effect on the stomach lining. And once you have these things, there's also different kinds of antibiotics. The reason being, if the more you abuse these antibiotics, really, the more you abuse them, the harder the bugs get. The harder they get. That's what it is. It becomes even more difficult to treat them, because then you're using this kind of antibiotic and it doesn't work anymore. Or it looks like the patient will get some bit of improvement, and then he goes, and in a very short period comes back with the same symptoms again. I mean, that's the whole reason, one of the major reasons why we use different classes of antibiotics, all in the with the sole aim of targeting this bacterium, the H. pylori. And some people may also not be comfortable, or they may show allergy, or the drug may show, the bacterium may show resistance to a certain kind of drug. Then we can have different drug combinations. So yes, there is treatment for peptic ulcer disease. There are other ulcers that may not necessarily require medicines, but by and large, most of the time, treatment is with medicines. And it's most of the time only the complicated cases that may require surgery, the recalcitrant ulcers. I mean, you treat for a first time and then it doesn't go, or the person goes with just little improvement and then comes back and then the same thing. And then investigations look like the ulcer is not really healing, but the person is taking the medicines, or the person has one of these genetic things that make it very difficult to treat the ulcer. So then you'd have to have surgery to take care of these tumors that can elaborate a lot of hormones that make the ulcer production a lot more. So it's important. Medicines are helpful, but then you can't just go over the counter and then say that you're looking for this antibiotic or this antibiotic. And for others too, they may require some of these acid-lowering drugs for quite a long time, especially those who are taking it for joint pains, are older folk who are taking it for joint pains. And because of the ills of the antacids or the acid-reducing or acid-lowering drugs, they may require some stomach protectants together with their painkillers. So yes, there is treatment, and that's the long and short of it. There is treatment, and you need to seek expert opinion, not just talk to anybody about your symptoms and then take anything they tell you hook, line, and sinker. It probably may not just be the peptic ulcer. Yours may be something different. Hopefully, once we are taking good care of ourselves, once we are eating well, not engaging in any on helpful lifestyle activities, we should help protect ourselves from the effects of this acid and pepsin, or the digestive juice digestion of our stomachs. Now, after treatment, usually the medicines are given for a 2-week period, a 10 to 14-day period, and hopefully they should stop. And it's not something that you continue taking and taking and taking. It's a treatment. It's not how do you put it, a management sort of thing. So it's a treatment, and once you treat it, and that's it. And you don't become. It's not a once I have an ulcer thing, I forever have an ulcer. No, it doesn't. It's not like that. Once you get it, and then you are treated, and the follow-up test and results show that you have been cleared of the infection or the ulcer has healed, it's important to know that you no longer have ulcer. Then you may probably think of lifestyle modifications. If it was alcohol, if it was smoking, if it was certain foods that give you the symptoms, then you know what to take out and then what not to take out. If you don't have any meals that are giving you any symptoms, why not eat really balanced diets and live a very good life? Now, there are certain ulcers that would definitely require additional intervention, especially when it comes to the stomach ulcers. Usually the ones that affect the first part of the small intestine, the duodenal ulcers, I mean, once it heals and it's fine, you don't have any other symptoms, you probably may not require a lot of follow-up visits like that. But stomach ulcers, usually, especially if you're an older person, it probably may not just be an ulcer. It may have something sinister lurking around. So then you require a lot, maybe just a few more follow-up visits, just so that everybody's satisfied. It is not anything you are not looking for, really. And then simple and very stubborn ulcers. Some ulcers are very recalcitrant. You treat and then it recurs. You treat and it recurs. Then you need to find out why it is recurring that way. It could be because of a tumor somewhere that is causing the body to produce a lot of acid. In that case, you need to take out that tumor so that, I mean, it is treated. Others too are probably not following the prescription, and so are not getting the bags cleared properly. So then you have resistance develop, and it becomes even all the harder to treat these ulcers. Certain simple ulcers are simple in the sense that after a course of treatment, everything is fine. The ulcer is healing. You don't have your symptoms again. You can continue doing your regular daily activities. without any kind of stress. I mean, these ones, once it is just a few follow-up visits, and then you are free to live your life. Other ulcers, you need definite follow-up visits. And of course, there are things that you need to do to improve your chances of getting your ulcers healed, really. And this is how we eat in our sub-region here in South, western part of Africa. I mean, you go to our markets and this is how the things are arranged. I mean, these are really healthy foods. Our green leafy vegetables are fruits. I mean, these things are loaded with a lot of antioxidants. They are loaded with a lot of micronutrients, vitamins that help the body fight off infection, one, and then two, provide nutrients and are able to scavenge these free radicals that even worsen the ulcers. So then people who have a lot of these things in their diet, because of the high fiber content, because of the high amounts of good vitamins and the minerals that they have, they live healthier, happier lives. Their gut is really happy with them, because then again, it's not just about your stomach, even your colon. It depends so much on the fiber from these things, just so that it can help fight off some of these cancers that come into your colon. So high intake of these things is very helpful, and not just because of the ulcer or the cancer, even for your own overall well-being. Your ability to fight infections, your ability to maintain healthy blood pressure and healthy sugars. These things are very, very important. You eat well, you eat healthy. Fruits and vegetables rich in antioxidants. And I mean, looking at wound healing is a very important thing. And not just about ulcers on your stomach wall, but even wounds even on your legs or anywhere. Anywhere there's a wound would require good amount of nutrition, so that your body can form the appropriate substrates to bridge or close up the wound. And usually, these foods that are rich in antioxidants are the foods that are really helpful for you. Now, it's important to know and limit the foods that worsen your symptoms. For a lot of people, fizzy drinks really worsen their symptoms. Others, they say when they eat a lot of pepper. I mean, that's fair enough. Just know the foods that would worsen your symptoms, and then try and limit those things. Not to say that these foods will cause your ulcer. No, they don't cause the ulcer. But if you're having symptoms or these dyspeptic symptoms, or you take this particular kind of food, you usually get heartburn, or you usually have this pain in your upper abdomen. I mean, it just presupposes that then you have to limit it and then look for suitable alternatives. All right, excuse me. And it's important, because once you have healthy diets, once you eat well, once you eat the right kinds of meals, I mean, food becomes your medicine, really, and you don't have to make medicine your food. So then the benefits that come with eating healthy, eating well, eating fruits and vegetables cannot be overemphasized. These are very important. And with a smoke, I mean, there's no two ways about it. Just quit smoking. It probably may be easier said than done, but there's always support for anybody who finds themselves in some of these habits that are probably not good for their lifestyle or the overall well-being. Smoking, one of the biggest risk factors for a whole lot of things. This heart issues, myocardial infarctions, those heart attacks, the ulcers you have on the legs, cancers in general, and even a whole lot of things. I mean, once you smoke, your risk for a lot of diseases, especially cancers, increases. So it's just in the best interest of the body and your own best interest to quit smoking. And then those who can, and it's important, let's use these painkillers only when we have to use them. It shouldn't be things that we just fall on, especially when we are having dysmenorrhea or very painful menstruations, then I mean you just pop a brufen or you pop diclo, because really that's it helps. And it becomes all the time brufen, all the time diclo. I mean, if you need to take it, fair enough. I mean, there are ways and means to take it so that you don't become dependent upon them. For other people, like I say, the older folk, they almost always get something to protect their stomach lining, just so that they can be protected from the ill effects of these painkillers. And of course, limit alcohol. For whatever reason, it's important that just limit your alcohol intake. Not necessarily stop it outright if, I mean, you like your occasional beer or your occasional wine. Just for the sake of, if you are drinking alcohol and you're having these symptoms, I mean, try taking it out and then see. It probably may be the culprit for the symptoms you're having. Now, and it's looking at all these things. There are things. A lot of people have asked me, are there other things that you can use to help your ulcers heal, or to even get yourself on a very healthy trajectory? Well, for me, I have a few things that I readily recommend to people. At this point, Dr. Albert. Hello, Dr. Albert.
Yes, Dr. Mike. Yes, Dr. Mike.
Yes. I just want to ask permission. Can I make a few recommendations?
Yes, please go ahead, and then we'll take questions. Yeah, please go ahead.
All right. So thank you very much. Yes. So I was talking about a few things that people usually ask. I mean, things that can help them if you have an ulcer, if you have a wound, even you're not feeling very well, you sleep, you wake up tired, you're not having enough energy to go through your day. I mean, are there things that can help you? Well, for me, I readily recommend a few things, probably because I've seen the benefit for myself and I and my family, really. So I just go all out and then recommend a few things, and I'll just share with all of us these things. And for me, it is Max 1 and Infuse, especially for people who want to have quick healing of their ulcers. Now, all these things, what Max 1 does is it helps your body produce its most powerful antioxidants. So just like your vitamin C's, your fruits and vegetables will help you with the antioxidants needed by your body to heal the ulcer. This one helps your body produce its own most powerful antioxidant. And together, the Infuse, it's a whole nutritional package, really. A lot of vitamins, a lot of minerals, all in a bit to help your body scavenge or take away all the free radical species that worsen your wound, your ulcer, and even your overall well-being. These two readily come to mind, readily are recommended. These are not the ones that treat the ulcer. I mean, let's just have it. These are not the ones that treat. These are just adjuncts that you can use to help your ulcer heal faster. And not just that, but then also, I mean, you feel very good in the sense that you don't sleep and wake up tired. You have a lot of energy to go through your day. Those joint aches and pains, you don't have them. And I mean, you are all through very overall healthy, really. And so for me, these are my two go-to things that I readily recommend to people who want an additional thing to help them improve their general well-being, and also whatever medicines they are taking, especially if you are taking ulcer medication, just so that it can improve your chances and then your rate of ulcer healing. These are things that I readily recommend because of what they do for the body and how they help your body also improve its own function. So, I mean, thank you everybody for your attention. Thank you for staying with me all throughout up to this time. I'm sure you have a lot of lingering questions on your mind.
All right. Thank you very much, Dr. Michael.
I'd like to take some.
Thank you very much, Dr. Michael. The take-home points are very clear. The symptoms of ulcer, upper abdominal pain, it may be ulcer, it may not be ulcer. So seek expert help. The bug, the germ, H. pylori, is linked to causing ulcer. However, it's not all of them. There are a lot of strains of it that causes it. Not all of them causes. And also, free radicals that he's mentioning are what we call toxins. The toxins in our system, and from the literature, it is proven that those toxins can lead to the formation of the sores in your stomach lining that worsens your ulcer. That's why the recommendation of something that can help you take care of the free radicals is very, very important. And also, stress. Stress can result in ulcers. Stress, it cannot be overemphasized. Stress can result in, of course, we all know what's happening in the economy. And so we should always seek expert help. Now, at this point, we're going to take some questions. Please put in the chat box, type in the chat box. In the meantime, Dr. Mike, we have 2 questions for you. One person is asking, if you take orange before going to bed, is it bad because of the acidic contents?
Okay. So, I'll just add another question to your question. If you take orange first thing in the morning, is it also bad because of the acidic content? Well, fine. It depends on the kind of, if you're looking at acidic content, usually the very sour ones have more acid than the rather ripe ones, and you can tell by their sheer taste. But studies have not really proven that if you take orange on an empty stomach, you get an ulcer. If you take it last thing going to bed, you get an ulcer, or it will worsen your ulcer. Then again, if you do that and then it gives you symptoms, I mean, it just makes sense to put it together with a meal or put it around a meal so that you don't have your symptoms. But it sounds good or pleasing, or it makes sense, or let me say it sounds reasonable to think that if you take an orange on an empty stomach, you're going to get an ulcer. But it's not always or entirely the case. You can take your orange, and whilst it's important to eat healthy, it's also important to choose wisely. So for me, I usually sleep late, sometimes because of work, because of study. And instead of taking a high caloric fruit juice or a high caloric something that would adversely affect me, I'd prefer taking a fruit, let's say an orange together with the roughage and or an apple. I mean, that way I get the benefits of the fiber, I get the benefits of the vitamins, and I don't have any tummy upsets, really. But if you take it and then you get tummy upsets, just take it, you can just take it out of, or you can just change the timing. It doesn't necessarily mean that it will give you an ulcer. No, it doesn't. And I can see in the comment section again, you need to take omeprazole every time you have to eat. Yes, like I said, if you've been treated for the ulcer, no need to continue taking omeprazole all the time you have to eat, all right? It doesn't have to be so. It's not because you've had an ulcer, you forever have an ulcer. No, it's something that can heal and then you can be symptom-free. But if for certain reasons you've treated and it's not healing, then you need to be really investigated. You really need to be seen properly so that we get to the bottom of it. It probably may not be peptic ulcer. It may be something else causing the discomfort. So it's important. If it's been recalcitrant, your symptoms have been ongoing for a very long time, you treat, you still have the symptoms, then you probably need to get properly evaluated. And another person, Bang Chiriga, wants to know if ulcer can affect pregnancy. Well, pregnant people can have ulcers, that one for sure. Whether it can cause your miscarriage or give your baby defects, these are not things that are readily that have been easily documented. Fine, you can get ulcer in pregnancy, and like I said, it is something that is treatable. So you shouldn't have any ills if you are planning on getting pregnant. You can still go ahead and get pregnant, and it doesn't take long to get a simple ulcer treated, really. About 10 to 14 days, you should be treated. And if you continue having symptoms, and then again, because of pregnancy, the hormones, they tend to have these reflux because of the relaxation effect of the hormone. So they tend to usually have reflux and then heartburn. That probably may not even be an ulcer. It's the effect of the pregnancy hormones and then the reflux. So they may have heartburn. It doesn't mean they have ulcers. So pregnancy and ulcers, they can coexist. And I mean, pregnancy can also go on unhindered by the ulcers or its treatment. I'll take a few more questions. Can one die from an ulcer? Then again, it depends on the cause of the ulcer and what complication it brings. So if the ulcer is in the stomach and it's usually maybe a stomach cancer, it's something that you can die from if you're not treated. And even if you are treated, I mean, there's a prognosis depending on how badly spread it has gone. It has gone. So a simple ulcer, usually you don't expect to die from a simple ulcer. But then if it's complicated, then the chances become grim. Then again, these things are not things that you cannot treat, you cannot take care of. Even if it's complicated, the bleeding ulcers, the perforated ulcers, and even the ulcers that cause obstruction, there are surgical procedures to correct all these, especially once they are reported in a timely manner. So don't take certain things too lightly. When your stools start turning dark, you're not drinking Sobolo, you're not taking any iron supplements, you should get to the hospital to be checked. All right. And then ulcers in children, which drugs can be recommended? So for children are not small adults. And usually children don't get the peptic ulcers that we get. Yes, they may tell you, I'm having this pain here, this pain there. Just so that you are put at ease. Children can also have an endoscopy done. I'm not saying that children cannot have ulcers. It's possible. It's possible children get ulcers, but it is not as rampant as it is in the adult. So then with regards to drugs that are recommended, it's best if they see the pediatrician or the pediatric surgeons. These are the people, they do the endoscopies and then they see, and if they see it is an ulcer, then they'll have their own doses of these medications giving them. Then again, the mainstay will be to eradicate whatever or to treat the cause of the ulcer. It could be something that's causing the body to produce a lot of acid, or it could be anything really. So it's important to get them sick. Another person asked me the smoking, and then a colleague of mine said, Michael, talk about the smoking and kissing. A lot of that goes on in the clubs. Well, fine. The smoking really is something that I can't keep hammering about. I can't stop hammering about. Smoking is one very big risk factor, not just for ulcer, for almost every known disease that you'd think about. People who smoke are at an increased risk of the morbidity that these diseases come with. And because these bugs are spread by the mouth or through the other opening, the backside, it's been shown that some of the things that the tatters, the calculus in a they harbor some of these bacteria. So know who you kiss. I mean, you just don't go kissing everybody and anybody just because you're in the mood. You probably may be getting things into your body that you don't know. So just be informed. Kissing may just be another route of spread of the bug. Another person also asked, why is it that ulcer patients are not to take Kinky? Well, ulcer patients can take Kinky. If you take Kinky and you get symptoms, it just makes sense to limit the amount of Kinky that you take. Somebody may argue that probably because of the alcohol, the fermented Kinky will produce. But I mean, you can eat anything, especially if it doesn't give you symptoms. So just pay attention to your body and then know what doesn't give you the symptoms, and then focus on those things. All right, the fizzy drinks, some would say pepper and all those things. If they give you symptoms, just take them out, all right? But by and large, the things we talked about, eat healthy, eat healthy, eat healthy. You can't overemphasize that, all right? You can't overemphasize. Yeah, so Freddie wants to find out if ulcers cause pain in the chest area. Yes, it does. I mean, so that part of your tummy chest, or that part of your tummy chest between your rib cage, sometimes when you feel that pain, it can even extend a little bit upward. We call that retrosternal chest pain. So that together with reflux, you can have pain in that area. You can have pain in that upper abdomen, and it can extend all the way up the middle of your chest. So ulcers can cause pain in those areas. And doesn't mean if you're having pain in those areas, it is ulcer. All right. So if you're having pain, or if you frequently have pain in those areas, not really related to meals, not associated with meals in any way, you probably need to get it checked, because other things can cause pain in that area. It can be from your heart, can be from your lungs, can even be from your esophagus itself. All right. Your food pipe. All right. All right. So Rosie wants to know, sometimes when she takes breakfast, she has pains in the stomach. Is it ulcers? All right. So before ulcers develop, especially with a bug infection, there's something called gastritis. Gastritis means inflammation of the stomach. You may have pain if you take breakfast, especially if it's a late breakfast, probably because your stomach is not really ready for the food, or for the huge amount of food. So you may have some discomfort. People who have gastritis, and not necessarily full-blown ulcers, may also have some discomfort or some pain in their stomachs. That doesn't mean you probably have an ulcer. It's possible if you have ulcer and then you eat, especially if it's a stomach ulcer, you may have pains. But that doesn't mean sometimes, if it's a one-off thing, maybe once in a while you have pains when you eat, it doesn't mean you have an ulcer. No. The simplest thing you can do is just to get tested. You can get your stool cultured and see if you have H. pylori. Apart from that, if you're not getting these pains that are always there, that are relieved by the antacids or the milk, these pains that come on usually at night, and then they would want, you need to take an antacid before you can sleep. Likely, probably maybe something else. Is it advisable to take banana whilst treating an ulcer? Why not? You can eat your bananas. It doesn't change your ulcer treatment in any way. It doesn't change your ulcer treatment in any way. You can eat your bananas, all right? And then it says, can skipping food cause ulcers? It probably may aggravate the pain of your ulcers. Skipping food can aggravate the pain of your ulcers. And once the stomach is empty and you're always thinking about food, your body is also producing acid, because acid production starts the moment you start thinking, smelling, seeing food. So once these things, and you're not eating, you probably may be worsening an already developing ulcer. It probably may not necessarily be the cause itself. So one thing I tell my colleagues is that, see, watch is 10 cedis. Nexium or any of these medications, if you want the very correct ones, you spend less than 50 cedis. So choose how much you want to spend, whether you spend on Nexium or you spend on food. So it's important. Eat, all right? And once you eat, and eat the right things, of course, you reduce your chances of having your acid act on an empty stomach. Please, can peptic ulcer cause waist pains? Peptic ulcer and waist pains. Now, peptic ulcer in its truest sense usually will not refer to waist pains, unless you have something else happening elsewhere. Maybe the ulcer may not just be peptic ulcer, it probably may be a cancer in the stomach that has spread to the bones. But this one, it's a long stretch. It's a very long stretch. So there are probably other reasons why you are having the waist pains, and it needs to be identified. And yes, you can have H. pylori and develop peptic and not develop peptic ulcer. Yes, you can. You can have, not all the strains are give you the peptic ulcer, and not all the strains too are responsible for the cancers that happen in the stomach. But then again, why take the risk? If you test positive for H. pylori, let's just eradicate it. Especially now that we are more enlightened, we know what water to drink, who to kiss and not to kiss, what kind of food to eat. It's important. Let's eat well. Let's if you're having symptoms, then you can get tested and you can have the H. pylori eradicated. Not all the strains would give you or would make you symptomatic of peptic ulcer disease, and not all the strains can even would make you develop the gastric cancers. But once you test positive for it, why not treat it? All right. Yeah, so I talked about the kissing. So it's not a hard and fast route for the spread of the bug, but it's important to just take note and then stick to a healthy lifestyle. So you don't just go about kissing anybody anyhow. They probably may be harboring some of these bugs. Some people have had the H. pylori cultured from calculus sticking around their teeth. So let's just have it in mind. Let's just have it in mind. And Anna Kwame wants to know if ulcer can cause cancer. So the reverse is true. Cancers can cause ulcers, especially cancers of the stomach. They may present as an ulcer, and whatever the cause of the cancer, if the H. pylori is responsible, it's possible with the chronicity of the whole infection. It also causes certain changes in the stomach cells, and then a cancer can develop. So then it probably was not the ulcer that caused the cancer, but it was the bug that caused the cancer, the ulcer that caused the cancer. So it's important to note the cause of the cancer could be the reason for the development of the cancer. All right, the cause of the ulcer could be the reason for the development of the cancer. And yes, cancers can also, especially of the stomach, can show up as ulcers. The most important thing, seek medical attention. If you're having symptoms, if you are thinking, if you're not sure what you are feeling, could be an ulcer. You don't just go to the pharmacy and then tell them you want medicine for ulcer. Of course, you'll be giving something to help control the pain, but it's important to seek medical attention. And all these things can be found out if you have to do tests that can rule out other things that may be responsible for your symptoms. It's important. Medical attention is very, 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 very important. Seek it from the people who are experienced in their craft to give you their opinions. Well, I'm sure you can walk into a lab and then have an H. pylori test. But then if you walk into the lab and get an H. pylori test, who interprets it for you? So it's best to speak to somebody so that the person can request it and then help you with the interpretations. And if you want to do the non-invasive one, there's two culture. There's two tests. It's preferable to the blood test, because the blood test, well, you may find something, but it may not entirely be accurate. So either that, the breath test, or you can have an endoscopy done to see if the bug is there. And yes, and I just got something too. A friend hinted me that as part of the bug spreading through your saliva and other things, maybe just keep your water bottle to yourself. All right, you can pour it out into a cup and share, but sipping from the same mouthpiece all the time may not be entirely healthy. Not just because of H. pylori, corona is around, a lot of other things whose names we don't know are also around. How they spread, we are not too sure. So just, you don't know where that mouth has been. So just keep your bottle to yourself. If you want to share, you can share in cups and enjoy camaraderie. All right. So it's been a beautiful experience with everybody here, and I thank everybody here for their questions and for the feedback. It just makes me know that you were paying attention and then you understood. All right. So thank you very much. Thank you very much. Thank you very much. Dr. Sedo here, I'll just let you take over. I don't think I have any other questions anymore.
All right. Thank you very much.
Thank you very much.
Thank you. Somebody also asked about how do you know the actual cause? Now, how do you know the actual cause? You cannot be so specific. For example, if it's caused by the painkillers that you are taking, if you stop it and the symptoms resolve, it means that is what caused it. If it's the alcohol, the smoking. So it's the risk factors that you should focus on, the healthy lifestyles. You should not be so worried about going to test for H. pylori, because the fact that you tested positive for H. pylori doesn't mean you have ulcer. All right. So the focus is, if you have symptoms that you're not sure of, just seek medical expert. That's all we are here to help us all. Somebody is chatting me that the product that you recommended that can help speed up the healing process. If you can show the person again, somebody is asking me privately. Somebody is asking me if you can just show the person in a jiffy. So thank you very much for the feedback, the questions. So these are products that can help speed up the healing process, because free radicals, oxidative stress, result in formation of the sore in your stomach lining. If you take things that are able to build up your oxidants, your antioxidant in your system, it can help you speed up the healing of the ulcer. The Max 1 and then the Infuse. Thank you very much, Dr. Michael. We appreciate your time. Now, if you learned something, just put value in the chat box. If you learned something, just put value in the chat box.